We now move to Gordon Wu. Gordon, many of you in this panel are epidemiological modelers, so one parameter that you all work with is the R0, the basic reproductive rate. And you've said that it's not just a virological thing, it's a combination of virology and sociology and some complex combination of the two. So can you explain that to us a little bit more, and also how recognizing that it's a sociological and a virological thing helps us think differently about the trajectory of an epidemic?
Okay, thank you. Nathan quite rightly said that pandemics are not like NatCat. Indeed, that is true. Now, if you take earthquakes, we can't predict earthquakes, but once we know an earthquake has occurred, we are pretty good at calculating the way that the effects of the earthquake will propagate from the source to a site of interest, like a building, a dam, or whatever. These calculations are based on the mechanics of elastic media. These equations were written down several hundred years ago. They're still okay today, and so we do a pretty good job of that. Now, if we turn to pandemics, we can't predict when a particular new virus will emerge. We can't predict the timing of some genetic shift. So we're in the same boat as with earthquakes on that front. However, when it comes to trying to figure out the propagation of a pandemic from its source to other parts of the population, we're not good at that. We're not good at that. Why? Because this propagation is mediated by human beings, not by particles of soil or rock, as with earthquakes. A lot of epidemiology as a science has evolved from application to animals, animal husbandry, diseases in animals, and so on. Animals are not human beings. So in particular, one of the key elements required to model the emergence of pandemics involves social psychology. We've heard about virology, we've heard a lot about epidemiology, we've heard nothing today about social psychology. There's a basic principle of social psychology which applies to all disasters, both natural hazards and man-made, which is the principle of social proof. The principle of social proof applies to all disasters. The principle of social proof. If you don't learn anything about social psychology today, please go away with those two words in your head. Social proof. People do what others like yourself are also doing. Social proof. So in other words, you see what other people who are a bit like you check out what they're doing, and you try to do the same. That's social proof. It's a principle of social psychology. Now, this is very relevant to the way that pandemics propagate, because if you take customs by which people react to disease, people will tend to follow what other people are doing. Come back to R0. R0 is a product of two factors. One is the number of people in your social network. The other is the likelihood that if you come in contact with someone in your social network, that an infection you may be carrying may be transferred to that other person. These two parameters. Both of them depend a lot on social psychology. If you take your network, these are the people that you normally hang around with, your family, your friends, and so on. And during a time of a potential pandemic crisis, the way that these networks transform is crucial to the way that a pandemic will propagate. The other parameter is the likelihood that someone whom you come into contact with will contract a disease that you may be carrying. That depends also a lot on social factors. For example, customs by which you greet people, whether you hug them or kiss them or shake hands with them. So these are all factors which are crucial in determining what this parameter is. And so if you take the product of these two parameters, you can get an R0, which is way different from that which you might imagine otherwise. And what we saw during the Ebola crisis was an amazing transformation in some of these social customs, in terms of funeral customs, the way that people greeted each other, people no longer touch the dead, and so on. And this is a key part of trying to control an epidemic, but also a key part of trying to model it as well. So that's actually such an important point to make about any kind of modeling process, especially in the early stages, because once a pandemic has taken hold, then the standard equations of epidemiology, which are based on mass action, essentially treating people like chemical particles, etc., then these equations do quite a good job of modeling pandemics in the large. But if we're trying to track a pandemic in its very early stages, then we really need to throw into the mix of subjects to be considered apart from virology and epidemiology and social psychology, try to understand the way that people are behaving, and in terms of mitigation, because one of the parts of your question was the way that the trajectory of an epidemic could be changed. Well, if there's more attention paid to some of these sociological issues, I think there'll be more appropriate actions taken to try to contain a potential outbreak.
Thank you. And knowing about social psychology and disease transmission, how do you think this impacts the need for financing or the kinds of funding instruments? And also, how does it impact the triggers, and should there be, in what stage of the disease spread do you place the triggers?
Well, again, this is a very challenging question. One of the important implications of what I've just said is that if you do a study of an outbreak of an emerging epidemic, which might be, for example, in a rural area or perhaps in an area of low population, then clearly the social networks are going to be sparse. And in fact, the whole subject of doing mathematical epidemiology on sparse networks is very different from doing epidemiology, assuming that people form a continuous population. It's very different. And so what we're talking about is a whole different type of mathematical analysis required to try to assess, given a sparse network of people who are living perhaps in a jungle or in a sparsely populated area, just to figure out how to interpret the findings in terms of the number of people who've contracted the disease amongst the population. So this is going to be crucial to be able to take into account the way that epidemics develop on these kind of sparse social networks. And I should say that with the typical applications of epidemiological modelling, which has been used for insurance applications, we've not really had to face this problem simply because we've been dealing with very large catastrophic pandemics where the assumptions of mass action and treating population as one continuum, well, that assumption has not been too bad. Okay, so I'm really making the point that we really are in new territory here in terms of modelling. We're dealing with sparse networks where the traditional equations break down, and so there's a need to really take into account the local circumstances. So if I can just say what the implications are most significantly, it could well be the case that if there are a there are a number of cases of a particular infectious disease in a jungle area, that superficially the R0 might appear to be low, and therefore it might appear superficially that there's not going to be a problem. But if you were to do the analysis on a sparse network, take into account the limited contact between people, you could figure out, in fact, that the actual lethality rate or case fatality rate for this particular outbreak was actually pretty alarming, and you'd want to trigger on that. So that's just one example of how doing this kind of analysis in a different way would impact on the trigger definition. So I think I'll stop there.
Okay.